Thank Debbie Wasserman Schultz for her courage to get up here and talk about her ailment. I too am a cancer survivor, and it is a difficult process. But my concern is greater than even our own personal experiences. It is what is the actual result of that health care reform bill that leads us to this resolution. We are scrambling around on the floor today to say that a government-appointed commission, this task force, has made a recommendation based on quality of year lives and cost, not good science, not what saves lives, that women between 40 and 49 need not get mammograms. And you say, listen, that doesn't mean rationing, it doesn't mean anything, it doesn't have any weight of law. But guess what? The health care reform bill that passed this House makes those recommendations law. Let me read a couple of quick things, Mr. Speaker, if I may, in one section. And by the way, you have to go to 3 different sections, 2 different complete books to understand how this impacts real women in America, some 2,000 pages into it. One section, limitation on individual health insurance coverage may only be offered on or after the first day of year 1 as an exchange participating health care plan. Pretty fancy Washington speak. Let me tell you what it means in another section of the bill about 1,000 pages later. A health plan is prohibited from offering coverage for benefits not included in the essential benefits package. And you say, oh, no, that's a floor. It is not a floor. The language in the bill goes on further. And you know what it does? It says that it's the only difference between the levels of plans is the amount of cost sharing, not what it covers. Here's the scary part, of which I don't think you all realized that you did to about 47,000 women in America. All recommendations of the Preventive Services Task Force and the Task Force Community Preventive Services is in existence on the day before the date or the enactment of this act and shall be considered recommendations. The bill goes on to say that they must use that in the calculation of benefits. Guess what? 47,000 women who are under the age of 50 today will be diagnosed with late-stage breast cancer because of your bill. It's in your bill. It's in your language. You know what that means? 80% of them will have a mortality rate. Will die because of their diagnosis. Do you realize that's more women will die because of this bill than we lost men in the Korean War? And I know you think, oh, scare tactics. No, it's the bill. But you know what? You can't read it on page 1 or 2. You have to keep going back and forth in 2,000 pages to understand the full impact of what will happen to women who are 40 to 49 years old. You did it in your bill. I am going to plead with you for the lives of 37,000 women who will die and 47,000 women, according to the recommendations of this task force, which you make law, will be diagnosed. An additional 30 seconds, if I may.
Gentleman's time.
I yield the gentleman an additional 30 seconds.
I'm going to plead with you. Please read the bill, not just 1 to 2,000. You go back to the other sections and understand its full impact. And you say it won't happen in America? Guess what? This task force recommendations resulted on December 2nd for California prohibiting low-income women under the age of 50 for receiving mammograms. It's happening today. This task force is doing it today. With your bill, it be law. They are prohibited, and it is illegal for them to get coverage other than what the government says they can get. And guess what? Mammograms don't qualify for women 40 to 49. Please think of those women and those families.